once the many people start low carbohydrate diet, the constant problem that comes to their mind is when they can go back, when they can switch back to the original high carbohydrate diet. The answer is very, very difficult, because the once in a long duration when they consumed high carbohydrate diet with low fat, they got into the problems of obesity, they got into the problem of diabetes, they got into the problem of all other metabolic syndromes, like thyroid, like PCOD, like etc., etc. So many other problems. The root cause for that one is high amount of carbohydrate. Suppose after attaining certain about stability, if they reverse back to the again to high carbohydrate diet, again you are inviting the same problem again and again. So instead of that one, we can do a blood test. At the most, how much of relaxation we can give to the consumption of the refined or processed or the complex carbohydrates, instead of simple carbohydrates, complex carbohydrates like the fruits, like the legumes, like other things like brown rice. And these are the one complex carbohydrates instead of a simple carbohydrates which is available in white rice or the wheat, and those things we can avoid. And at the same time, we can take some kind of a complex carbohydrates, we can escalate the carbohydrate content, and we can enhance the comfort food in our diet. But again, there is no time specific for this one. It varies from individual to individual, and also based on the metabolic situation and also the pre-existing disease condition. For example, if you take the diabetes, a 20 years diabetic patient behaves entirely different a 2 years old diabetic. So the onset of diabetes and how many years they suffered because of that diabetic metabolic problem, it all decides how quickly he can go back or how quickly he can sustain in the maintenance phase. And the duration of a positive benefits also take longer time, and also going back also takes longer time. So one has to decide based on their individual criteria. But in general, most of the diabetic people will be controlled within about 3 to 4 months, and also most of the people will lose the weight to the ideal weight. This does not reduce the weight or it does not increase, and it depends upon the condition. If somebody is an overweight person, it will improve towards the ideal weight, it optimizes. Similarly, underweight person, it improves to the optimizing the ideal weight. So underweight person gains weight, overweight person loses the weight. So in that way, the diet is only optimizes the weight, but neither increase nor decrease. Though the most of the people are using for weight reduction, they may think that one, this is a diet for weight reduction. In fact, it is not a weight reduction diet, it is a weight optimizing diet. So in that way, one can use based on their goals. Again, ideal weight may not be the ideal for everybody. It is what we have to achieve for this one is healthy weight, healthy situation. Even though there may be 2-3 kgs this way or that way, it is not going to make a big difference as long as they maintain their health parameters well, and also they are feeling comfortable and they don't have any kind of major issues. Then we call that one healthy weight for that particular individual. There is nothing like an averages, there is nothing like a uniform formula, and one has to be customized every need of that particular individual.